Hello, my name is Sean Johnson, and I am a public health and health systems management major at the University of North Carolina at Charlotte. How many of you have experienced loss, patiently waiting in hospital rooms, praying and hoping for the best, only to be met with the worst? How did that make you feel? Probably not too good. The days, weeks, and months that follow are all filled with grief, but as years pass, that grief subsides because time heals all wounds, right? Now imagine you're in a position where you are facing loss every day, most of the time multiple losses in just one day. How does a person deal with the constant grief that comes from that loss when they are obligated to keep working? And how can a person continue to work in such an emotionally stressful environment? My TED Talk focuses on the care team of the health system and how we can better provide them with the resources that they need to manage their stressors and continue to tend to those in need. Because while their responsibilities lie in providing others with care, who is around to provide them with the same necessary care? The primary function of the care team is to provide quality care. Care teams can be found in a variety of areas in the health system, and teams are generally organized around a primary care provider. Nurses, pharmacists, nutritionists, social workers, and other healthcare professionals may also make up the care team, according to a practice facilitation handbook from the Agency for Healthcare Research and Quality. The care team is diverse and is put together to best fit the needs of a client. Different types of healthcare professionals make up different types of care teams in varying health systems, and each professional takes on different leadership roles to best fit the needs of their team and of their patients. A new challenge that healthcare teams are facing during the course of the COVID-19 pandemic is the struggle to maintain social distancing. Kevin Hopkins, MD, the primary care medical director for Cleveland Clinic Community Care, stated during an interview that in his system, standard exam rooms are either 10 by 10 or 10 by 12 feet. This short anecdote paints us a picture of the environment that our care team is working in while also trying to comply with physical distancing guidelines in order to keep themselves and others safe. It brings to mind the need for better organization of workers and services during an unprecedented time where we need to physically distance ourselves from others, which has proven to be a challenge, especially in a clinical care setting. Another challenge that has existed but that has risen in incidence throughout the pandemic is a shortage of workers in the health system. These shortages lead to the overworking of healthcare professionals that are still working to provide care as they juggle the tasks of what should be 3 workers per each individual worker. Workers are also realizing that the pay that they're receiving does not correlate with the amount of extra work that they are having to do. In a quote from the Healthcare Business Today team's article on the challenges facing today's care team, these shortages also lead to overall job dissatisfaction and more turnover in the workplace. These grievances can also be associated with instances of frustration, exhaustion, depression, and anxiety, and many more for our care team, impeding them from doing the one thing that they should be doing best, which is providing quality care. Leadership is heavily needed to address and correct the issues facing the United States health system's care teams. Leadership can come in many forms, and all it takes is one person to begin getting the ball rolling towards change. The path goal leadership theory could possibly provide some solution for the feelings of overwork and exhaustion from our care team members. This theory states that employee performance, motivation, and satisfaction are all dependent on the behavior of their leader. Administering additional support, validation, and incentive to keep going could be a great way to minimize stress and increase performance of employees while they continue to balance and adjust to an increased workload. This theory can also help to address the direct needs of the care team with those in leadership positions in order to work together to find solutions that benefit the team and subsequently the organization as a whole. Hersey and Blanchard's situational leadership model could also provide much needed assistance in dividing up responsibilities among care team members. This theory states that there is no one style of leadership that is better than another, and that a leader should adjust their leadership style to fit the needs of those that they are leading. This theory would help to assist in breaking apart responsibilities and assignments equally and assigning care team members with specific duties. This would help to ensure that no one person is carrying the weight of tasks that could be divided up amongst many. Working with this theory can present a leader and their team with the resources that they need to increase productivity and also minimize the manifestation of job dissatisfaction and in care team members. In conclusion, the care team is responsible for providing quality care, and they are currently struggling to do so. They will continue to struggle until one or few or even many decide to work towards presenting them with the resources that they need to comfortably do their jobs and to be satisfied with the work that they're doing in the conditions that they are doing it in. The next time you are in a healthcare setting, try asking a worker how they're doing. Talk to them, hear what they have to say, and think a little bit harder about just how much they're dealing with in order to provide you with the care that you deserve and desire. Thank you.